Doctor, my dad's not yelling at me anymore. We're really getting along a lot better. I think he did your homework. Yeah, doctor, I read the book you recommended, the book, The Kesney Method for Parent-Defined Child. Wow, it's an amazing book. It helped me a lot. And my son John is not having tantrums anymore, and it's really amazing how it improved the way I talk with him. You know what? You know what I did? I bought 5 copies more of the book, and I took to the school. I'm the principal, and we're all using, the vice principal, the teachers, and has made a dramatic change in the way we talk with the children. We had like 6 kids with really difficult behaviors. They all get better immediately. It's really amazing what this book is doing to our school. I know the doctor told me that parenting programs are the closest we have to vaccines in children's mental health problems. I remember a doctor explained to me that can work to decrease temper tantrums, can work for ODD, the opposition defiant disorder, can help children with anxiety problems. So this is really great. I really could see that happening to the children from school. And even the parents look happier too. I think they're really happy to see the kids behaving so well. And the doctor told us that actually the program became available more recently online. So we start recommending to the families to use it, and they really enjoy it. They find it very helpful too. So thank you. It was really very helpful information for me personally as a parent, also for me as a principal, and also to the teachers in our school, and for all the parents of the children at school. This has been a life-changing experience for us all. Thank you so much. And then I told the dad, wow, this is really amazing. I'm really happy for you, for your family. I'm happy also for all these other families that benefit from this knowledge, right? I was trying to help your family, but in the end, this information has helped like 300 families, right? All the families of the children at your school. This is really an amazing story. Thank you for sharing with me. And I'm just thinking now, you told me even the families are looking happier, right? Even the parents are looking happier, right? But because they start using the program too. And this is really match what the study says. Studies say that parenting programs can decrease the likelihood of children ever developing oppositional behaviors. If they do have the oppositional behaviors, can have parents decrease oppositional behaviors, and some studies say too, can decrease children's anxiety symptoms. And some studies say when parents attend parenting programs, their own mental health will get better. They are more likely to overcome depression. So I remember years ago when I used to still work on call emergency rooms, when sometimes I would see adults, like their parents, right? And I would frequently recommend parenting training as one of the treatments for the depression. Of course, we would recommend like psychotherapy. At times we recommend medications for the depression, but very frequently I'll add one sheet with list of resources about parenting training. And then with all the feedback I have, it has helped them to overcome the depression together with the other treatments they receive. Please review the video description for the list of resources described in this video, and for other tips on how to learn more. In child psychiatry, unfortunately, we don't have yet a vaccine you can just take and decrease the chance of your child developing like ODD, opposition defiant disorder, or anxiety problems. But we have programs like that can help a lot. It's not a replacement for other interventions like psychotherapy sessions. It's always important that your child see your doctor to exclude other health problems that could be contributing for oppositional behaviors. For example, a few children who are very oppositional, especially in the mornings, they have sleep problems. Talk with your doctor. Child may have to have some medical tests, for example, tests for sleep study, maybe have to have blood tests. Some kids are always tired, don't want to do things because they don't have energy. Sometimes they have anemia, right? So my point is always start taking your child to your family doctor. This video and no videos at my channel are replacement for the advice of your family doctor. My hope is this information will empower you to work better with your family doctor to achieve better mental health for your children. Child psychiatry has very effective treatments from therapy, medications, interventions with parents, family therapy. There's a lot of interventions can really be helpful and can help improve children's mental health. But among all these treatments, the intervention I have seen to have the biggest impact, help the biggest number of families with the lowest cost too at the same time, is parenting training. Check the description of this video. One of the programs that I mentioned today has been available online now for a few years and for free. It's completely free. It's amazing how much you can get from that program. Before you have to pay maybe $15-20 for the book, but now not even that. You can have access to all this amazing information completely for free online. In the video description, I list other evidence-based parenting programs. The method I mentioned during the video is the Kesney method, but there are a few other ones that are really good too. They are listed in the video description. This story is based on the real stories of families we saw at our office. No confidential information was disclosed in this video. Don't forget to subscribe to not miss our new videos.